My talk will take this outline, introduction, overview of nanotechnology and overview of COVID, the status, current funding status, estimates, and nanotechnology safety concerns, recommendations, and then summary and conclusion. I have two quotes here that I want to share. One is from Meet the Press. It says, I'm actually of the mind right now, I think this COVID is more like a forest fire. I don't think that this is going to slow down. I am not sure that the influenza analogy applies anymore. I think that wherever there is wood to burn, this fire is going to burn. And right now we have a lot of susceptible people. This is Meet the Press, June 2020, this year. The second quote is from Mission Local. It says, my whole challenge has not been about whether you wear a mask or not. I would throw the kitchen sink at this if it will help. The challenge is how well do they work so that the public knows what level of protection they are getting. And this is Mission Local. The talk reviews the current status of the roles nanotechnology is playing in this era of COVID-19, especially as it relates to product conceptualization, architecting, construction, development, and their release. Nanotechnology has been an emerging area for some time now. The interest in nanotechnology is the smallness of the sizes of nanotechnology-based products. It is applied across several industrial products, as we've seen, whether it is in telecommunication, electronics, biotechnology, or computational, and other areas of sciences. The ability to manipulate, organize, and measure matter at the atomic level in scales of 1 to 100 nanometers or 0.1 micrometers is what nanotechnology is all about. In terms of the definitions, 1,000 millionths of a meter is called a nanometer. And of course, 1 billionth of a meter is called also a nanometer. Example is human hair. It's about 80,000 nanometer wide, and the red blood cell is about 7,000 nanometer wide. Water molecule, about 0.3 nanometer wide. In nanoscale, it is of the size from 100 nanometers down to 0.2 nanometers. The study of this phenomenon, manipulation of materials, whether it is an atomic, molecular, or macromolecular cells, where the particles of the properties can be quite different from those of larger scales, are what we call nanoscience. And nanotechnology, as well as nanoscience, concern very important materials called nanomaterials or nanotechnology materials. Across the globe, there are a whole lot of nanotech companies, and a good number of them are located in various countries, a majority of them in the United States, Germany, and so on and so forth. These companies, when it comes to United States, a good number of them are in California area, and of course in other states, Massachusetts, New York, Texas, etc. The nanotech sectors that we have in the nanobiotechnology areas or nano devices, nano instruments, and nano powders, and nanotubes, and then there are so many of the others. In terms of the funding, since this COVID started, people have really been responding across the globe, whether it is funding for vaccines or any other unspecified areas or in the therapeutics. They have really answered the call in trying to make sure that money wasn't the issue. Here, individual pledges from different countries across the globe in trying to make sure that money is available. In US, they made the first supplemental appropriation to COVID, and also made the second supplemental appropriation, making sure that all the various agencies responsible for this that has what it takes to get the job done. Some pandemics with global epidemiological repercussions are infectious diseases caused by microorganisms of the most varied natures, and viral entities cause millions of deaths. We know this. 1918 was the Spanish flu, and you have 1957 to 1958, the Asian flu, and of course, 1968 was the Hong Kong flu. All of these cost millions of lives. You have also the virus influenza, which caused in a pandemic of 2009, caused 151 to 576 deaths within the first 12 months. Currently, the World Health Organization estimates that there are 290 to 650,000 deaths per year caused by seasonal infections of influenza virus subtypes. Of course, now we're in the era of COVID. The COVID was began in December of 2019 in Wuhan, China. Viruses such as coronavirus are the most smart and capable nanoparticles. These viruses have structural nanoscale features. And COVID has spread globally, infecting people with pneumonia-like symptoms and abnormal lung computed tomography images. The COVID, one of the key challenges with this pandemic is that the global challenges transcend territorial, political, ideological, religious, cultural, and of course, certainly academic boundaries. So it's all over the place, and it's something that we all have to take seriously. Just to this data I took from Johns Hopkins University of September 16 around 2:20 p.m. Globally, COVID has infected close to more than 29 million people. And out of that, 936 deaths have been reported. From there, within United States, there are over 6 million and over 196 deaths already. We hear of outbreaks on daily basis. One that is very prominent was the Diamond Princess cruise ship, where there were 3,711 people. And out of that, 700 were infected because of the closeness of the issue. The question then therefore becomes, can nanotechnology and nanomaterials help in the fight against COVID? The common transmission paths of COVID-19 respiratory disease starts with an infected person, releasing viral-laden respiratory fluid droplets. Within close proximity, other people can be infected. As a matter of fact, this diagram explains that more. With the droplets, whether it is airborne or contact with the person or some fomites, it is possible that one can be infected. The challenge then becomes on how we can exploit nanotechnology in fighting this COVID, and what kind of safety issues we putting in place. Nanotechnology is really making a difference. I was surprised as I was doing this study, what I found. In actually 7 lives. It plays a role in the diagnosing and treatment of COVID-19. It is also being used in the development of drugs against COVID. In addition, nanotechnology has helped bring new opportunities for producing inexpensive and scalable detection methods, personal safety equipment, and new successful medications, things that it has helped. Integrating materials into personal protective equipment, PPE, can prevent COVID in the respiratory system. Nanomaterials could also be used to deliver drugs to the pulmonary system via inhalators. Cellular binding of viral particles at the alveoli can be inhibited using targeted nanoparticles against angiotensin converting enzyme H2 receptors or viral S protein. Various mechanisms can be used to inactivate viral particles systematically, such as the neutralizing nanoparticles or the photocatalytic nanomaterials. And of course, you have, whether it is nanosensors, nanofilters, reusable nanofilter. Researchers have been investigating the potential of using nanoparticles to treat bacterial and viral infections for years now. Example, the gold particles made to attach viruses such as Ebola or influenza by heating the particles with certain infrared wavelengths, and the nanoparticles can then destroy the structure of the virus. Nanoparticles can also be used to deliver drugs as well. This is an example of nanomaterials where it can help prevent and for therapy for COVID. In this, you have the entrance to the respiratory tract, use of nanomaterial in PPE, neutralization of viral particles, nanomaterials based on photodynamic therapy, or nanomaterial based on vaccines and immunomodulation. All these are areas that nanotechnology can play roles. Because we do not have specific drugs or vaccines for COVID yet, early diagnosis and management are crucial for containing the outbreak. A field effect based biosensing device for detecting COVID in clinical samples. This is what Giwan and this group have been working on. The sensor was produced by coating graphene sheets of the FET with a specific antibody of COVID spike protein. The performance of sensor was determined using the antigen protein cultured virus and nanospecific swab specimen from COVID-19 patients. Then the FET device could detect the spike protein at concentrations of 1 Fg per ml in phosphate buffer saline and 100 Fg per ml clinical transport medium. This is the schematic diagram of the COVID-19 FET sensor operation procedure that the one used. Graphene as a sensing material is selected, and the SARS-CoV-2 spike antibodies conjugated onto the graphene sheet via the bupropionic acid and N-hydroxide ester, which is an interfacing molecule as a problator. So people are making efforts in this aspect. Nanotechnology also play a critical role for rapid diagnosis, monitoring, and design of effective therapeutic actions for COVID in relevance gut modulation. And as a non-invasive test that could be used, you have ingestible sensors can be designed for the detection of inflammatory proteins associated with COVID. Nanotechnology can efficiently be implemented in designing intelligent drugs or foods with the possibility of localized drug in the gut as well. These drugs and foods should target problematic bacterial strains in the gastrointestinal tract and enhance its health by improving gut bacteria against pathogens and inflammatory reagents, and by providing the base for creating disruptive remedies based on microbiome engineering. Nanoscale-enabled tools will likely enable us to observe, to navigate, and to act through the complicated ecosystem of the gut to help in finding either a cure or mitigating procedures for COVID-19. Nanotechnology intervention plays a vital role in bringing multidisciplinary ways of developing affordable, reliable, and powerful tools for diagnosis and personal protection and new effective medicines. Moreover, employing nanosensors significantly aids in diagnosing of the virus, even on asymptomatic patients. Likewise, the use of nanoscale fibers can optimize the protection affinity of personal protective equipment and face masks and allows their reusability for medical and economic benefits. Jie Wang and his group developed an alternative test method in the form of an optical biosensor. And the sensor is based on tiny structures for gold nano islands on substrate. And they had all kinds of other things that they use that are nanotechnology based. What of some of the antiviral drugs? You will now have the ritonavir or leponavir, remdesivir or abido. We hear a lot of chloroquine and hydrochloroquine. All these are things that people are using to see if there could be a headway in mitigating against this disease. In terms of protection, we always hear stay home, no handshake, avoid contact with sick people, cover your mouth, wash your hands, don't touch. These are things that people are doing to protect against coronavirus. Of course, anytime there is a birth of new technology, especially one as complex as what we're dealing now, there will always be things to be done. In 2009, there were over 600 different new products that were manufactured using nanotechnology commercially. As of March 10, 2011, that number grew to 1,300 products. And it was anticipated that by this year, 2020, it should be about 3,400. And you could imagine what with COVID-19 in place, this will really grow bigger than that. How do we really, in terms of safety? There are 5 principles of design for safer technology as prescribed by Gregory Morse. This was in 2010. Size, surface, and structure, alternative materials, functionalization, encapsulation, and reduction of quantity. This is an example of combating nanotechnology in bioengineering-based electronics manufacture capsule injecting antibiotics to a cell that contains targeted bacteria. This is an example of concept of nanorobot capable of delivering medicine straight to the virus location in the body via the body's bloodstream. In terms of recommendations, it is recommended that consideration for safety implications of advanced technologies such as nanotechnologies and for COVID should form part of the formal training of all workers and the general public. Employ public occupational exposure measures such as the use of PPE, limit exposure to gatherings, stay home where necessary for COVID and for nanoscale materials in the gaseous phases of powders. Monitor amount of material duration for use and particle size, prevent consumption of food and beverages in nano workplace. Use traditional environmental engineering controls, develop mechanisms to exchange information, and further studies will be necessary to deepen the knowledge about antiviral mechanisms. Various tests will be necessary, especially those tests that can speed up the results. We must acknowledge that challenging times require extraordinary efforts. Maintaining the health and strength of the global clinical workforce is critical to avoiding collapse of the global healthcare system. However, we can follow the Singapore and Hong Kong models in protecting the healthcare workers of the global society. We must continue to wear masks, social distancing, washing our hands, staying at home if you can, avoiding a large crowd. My conclusion The world currently faces a global health emergency. In the fight against COVID-19, research and technology development and deployment are our best weapons. Nanotechnology tools can be modified to treat, dictate, and prevent the spread of COVID-19. Nanotechnology offers a unique set of tools and can substantially contribute to our understanding of viral diseases and toward the critical development of diagnostic and therapeutic platforms. Together, we shall overcome this pandemic. That ends my lecture. Here are references that I use in the work, and research funded by Texas A&M University System Chancellor's Research Initiative, Texas Instruments, Sprint, and Northrop Grumman.